Hello, dear friends. I am happy to welcome you in the new year. My name is Sofya Dorinskaya. I am a doctor, the head of the Center for Medical Information and the School of AVITAMINOSIS. Today I want to talk about a topic such as iatrogenic vitamin deficiencies. These are vitamin deficiencies caused by treatment or medications. In various videos I have mentioned this topic in one way or another. But I really want there to be a separate video on my channel and a separate topic so that viewers of my channel come across it, and yes, doctors who visit this channel also come across this topic, and that this topic is clearly marked on its own. At the beginning of this video, I want to warn for those people who will be watching this video, I want to clarify that what I say does not in any way mean that you should stop your doctor's prescribed treatment. Prescribed medications are incredibly important. These medications are absolutely necessary, and these medications help to effectively manage and treat various chronic health conditions. But medication can cause vitamin deficiencies. Today we will talk about this, and it is absolutely essential to know about this to properly adjust the treatment plan and to take this factor into account in the treatment regimen. There are different kinds of medications. Medications can directly prevent the destruction of the body. For example, there are medications that help manage oncological diseases. Medications can help the body in its fight against some external influence, such as antibiotics, for example, and antibiotics have saved humanity. But that does not change the fact that antibiotics can lead to iatrogenic vitamin deficiency. As a result, their side effects can cause various types of vitamin deficiencies. Therefore, should antibiotics be used? Absolutely. I myself and members of my family follow treatment regimens when necessary. But it is absolutely necessary to take iatrogenic vitamin deficiencies into account and to understand how to address them. Let's discuss what kinds of iatrogenic vitamin deficiencies can occur. As I already mentioned, antibiotics. They cause vitamin C deficiency. Vitamin C, it increases the bactericidal properties of the blood and is always involved in the body's fight against various infections. The body always uses it up. When antibiotics are introduced, which destroy the bacteria attacking the body in various ways, these substances themselves compete with vitamin C, and as a result, vitamin C is depleted even more in a person. Therefore, both in the treatment regimen and during the rehabilitation period when a person is recovering, and when the course of antibiotics is finished, the doctor must take this into account and should include vitamin C in the treatment plan, also understanding and knowing this firmly, that a person can only get vitamin C from external sources. And once again, I repeat, vitamin C is not produced in the human body. The next group of drugs, for example, that cause iatrogenic vitamin deficiency, and we have talked about this a lot, I have dedicated several videos to this, are drugs that prevent blood clots, that prevent the formation of clots in the body. These drugs have different mechanisms of action, because in order for a blood clot to form, we are dealing with a living organism and a whole chain of reactions takes place. And there are different drugs that stop this reaction at different stages. Depending on how they stop this reaction, they are called by different names. But the point is, for the topic of iatrogenic vitamin deficiencies, the point is that regardless of which stage they stop this process at, the meaning does not change. They all cause at least a vitamin K deficiency. Why? Because vitamin K is involved in this chain and the body uses it up anyway. Do you understand? But there's another point, the biological point is that the body initiates this chain, which ultimately leads to clot formation because there is some kind of problem in the body. And if we stop this chain, the body still doesn't stop trying to deal with the problem for which it started this chain in the first place. Therefore, the triggering mechanism will keep working. That's why we end up with vitamin K deficiency. And I will repeat once again, I have never said anywhere that you should refuse the treatment prescribed by your doctor if you have been prescribed one, especially if you have been prescribed this for life. If there is a lifelong indication due to a pathology, you must not refuse it. Another matter is that you need to properly take into account the resulting vitamin K deficiency and manage it correctly within the treatment plan, within the process in which the doctor is involved. And the doctor is trying to help the person in order to prevent thrombosis, because that is necessary. The next group of drugs that lead to heterogeneous vitamin deficiencies, for example, are radioactive isotopes, treatment with radioactive isotopes. Which vitamin removes any radiation, any exposure from the body? That is nicotinic acid. Therefore, we can assume that this treatment will lead to pellagra, it will lead to a deficiency of nicotinic acid. Therefore, when you prescribe this treatment to a person, you need to understand the mechanism and what will happen afterwards. And in that protocol, whether it's the treatment protocol or the protocol for when the person has completed the main treatment and is already undergoing rehabilitation, you must take into account the resulting iatrogenic vitamin deficiency. The same goes for psychotropic medications. I want to say in general all of them. Neuroleptics, antidepressants, tranquilizers, it doesn't matter. They are all aimed at altering the functioning of nerve impulses. This is a change in the functioning of nervous tissue. When it comes to nervous tissue, the B group of vitamins is involved, especially vitamin B1. And all these substances cause vitamin deficiencies in the B group, primarily a deficiency of vitamin B1. Therefore, a doctor who uses any kind of treatment protocol must take into account the resulting iatrogenic vitamin deficiency. Why? Why is it necessary to take this into account? Yes, for one simple reason. Why do we go to the doctor? Why does the phenomenon of a doctor exist at all? Why do all these pills, medicines, and so on exist? Because ultimately a person wants to get well, they want to recover, to move from a state of illness to a state of health and to live as long as possible. But, ladies and gentlemen, vitamin deficiencies can be fatal. Vitamin deficiencies are deadly pathologies. If they are not taken into account, if you don't strive to eliminate them, then what kind of recovery can we even talk about? People have even noticed this phenomenon, and there's a saying about it. We treat one thing but cripple another. I've already talked about this too. So what exactly are we crippling? Well, this is exactly what we're crippling. We deal with one pathology and the medications lead us to another disease. Therefore, the topic of iatrogenic vitamin deficiencies should always be on a doctor's mind. And every specialist doctor should understand their own group of medications and figure out which iatrogenic vitamin deficiencies each drug can cause. How can this be understood? This can be understood first by the mechanism of action and second by the side effects caused by the substance. But here we also run into another topic. You need to know about vitamin deficiencies. Because if you don't know what kinds there are, what degrees of manifestation they have, I mean hypo or avitaminosis, what are the mechanisms behind the development of these vitamin deficiencies, the so-called pathological chains? If you don't know these mechanisms, you'll never be able to understand this topic. So, what can be done here? First of all, of course, you can contact us at the Center for Medical Information, take a test, and then go through the deficiency elimination program. And in a very competent way, based on a vast amount of information and extensive experience, we guide people and help them. On this path of eliminating hypo and avitaminosis, we lead them to a state of health. That's the first way. The second way, you can deal with this issue on your own. And here, please note, we have literature available. Read, study, apply, and think for yourself, please. The next path available is to enroll in the Vitagnostic school and become a Vitagnost. Of course, it's impossible to cover everything in the first course, but since we train Vitagnosts, and since this comprehensive educational training is specifically aimed at creating highly skilled professionals, by the very end of the first course, each individual person already has a specialized tool. A Vitagnost has a powerful tool to accurately identify and diagnose a particular vitamin deficiency in any patient. And we start with a deficiency of nicotinic acid, the basic course. How do you actually see that very tool? Because the problem is that another issue is that, well, avitaminosis, you can still see it. Not always, again, there are also problems with that. But when it comes to hypovitaminosis, in order to detect it, first of all, you need a lot of knowledge. And secondly, you need specific evaluation criteria. And this is exactly what we teach in our courses. So my friends, be aware that this is an important topic. Doctors, study your medications for one simple reason. If you don't focus on this, if you don't pay attention to it, you will never be able to bring a person to a healthy state, to guide them, to lead them along this path from a state of illness to a state of health. Of course, we are dealing with a living organism and some losses. Vitamins won't make a leg grow back. So some losses may be impossible for a person to recover. But in many cases, it is possible to extend a person's life, to prolong their life in a fairly good condition. I hope I have conveyed this idea today, and I will be glad if this topic resonates with my colleagues and also if it interests students. And people, they will understand that they need to make some adjustments to their condition and will come to the Center for Medical Information. Thank you very much for your attention. All the best. Subscribe to the channel, become sponsors. There are many videos there. All the best.